Welcome back to another episode of Sports Medicine on Tap. My name is Brandon Align. I'm sitting at a nice full table with two great friends of mine, Dr. Stephen Frey and our old friend, Jason Kopec, who's making his appearance back on the Sports Medicine on Tap podcast. Jason, welcome back, man.
Gentlemen, it's great to be here. Thanks for having me.
For sure.
We've been trying to set this up since you left.
Yeah. We're on a year and a half now, right?
Yeah, a little bit.
I cannot believe it's been that long. It's crazy. Yeah. I know.
Like sometime in summer of 22 was probably the last
22.
time I was down here. Yeah.
I mean, it sounds right. There was a ton of stuff happening.
Yeah.
It's all kind of evolved. And
Right.
Yeah.
It's lively down here tonight.
Yeah, it is. Yeah. It's good stuff.
Big Dungeons and Dragons get together next week, so
Right down
things
right
might get a
down.
little crazy tonight. So yeah, man, what's going on? How you been?
Things are going good. Love what you guys are doing here.
Of course.
Been following, like I told you, not listening as intently as I used to, but every time I get a chance, I try to tune in to the recent episodes. Sometimes I'm a little bit behind and kind of binge a few.
Yeah.
It's the way to go.
But love what you guys are doing, and real happy to see that it's continued on since my departure, I guess you would say. But
For sure, man.
I feel like like I said before I left. It's stronger than it was when I was here, and that was my ultimate goal all along. Steve, I think when you and I first sat down, I don't even know if we envisioned being on it the whole time either.
Right.
We just had the concept, and
Right.
so the fact that it's as great as it is today, I'm loving every second of it.
Yeah, I remember being like, big, monumental event, 10th show, monumental event. And,
Remember in the beginning, Steve, like we were actually sitting next to each other,
other,
like
right.
how weird it was back then,
That one picture, you guys like sitting next to each other, looking at each other. Yeah.
Yeah, it was like, man, it'd be easier if we just sat across from each other,
Right.
Yeah. And here we are on episode 86.
Yeah, it's
86.
amazing,
Crazy.
guys.
Holy cow.
Congratulations.
I think you passed the baton to me in episode 50 or so.
Kinda
Is that when it
remember
was?
that.
Yeah, somewhere around
something
there.
like-
I don't know.
Yeah.
I can check my notebook, but somewhere around there,
Yeah.
which is just crazy to think about that it's been that long, and here we are.
Yeah.
That's awesome.
So, and when you left, you had a really nice opportunity back at your alma mater, and you've gone over there. And then not only have you gone back to Westchester, but you've also done had a little side endeavor that you were familiar with.
Yeah.
Get going. Why don't you tell us a little bit about first, how things are going at Westchester, and then number two, tell us about the podcast.
Yeah, so I took the opportunity at Westchester University. I'm a tenured track employee.
Right.
So I'm an assistant professor. I'm the head athletic trainer there, working at this moment directly with the university's football team. And I kind of get to have my hands in all the other sports.
Right.
And get to kind of oversee the big stuff, but not necessarily the person at all the practices and the games. And then uniquely, I learned that every university has to appoint a NCAA healthcare administrator. So that's mandated by the NCAA.
Uh-huh.
So I fill that role too. And that's really like reviewing updated policies, making sure everything's up to date. The new concussion scat that came out. So I kind of had to update our program there in terms of using that scat on the sidelines and in our intake system. And then, the thing that I lost sight of was, giving back to the next generation of athletic trainers. So, like I said, I'm an assistant professor. I got to teach 2 classes over the summer. So it was the first 2 classes in their master's program.
Oh, man.
So it was injury and prevention and care of athletic injuries and illnesses. And that just covered spine boarding and splinting and bracing and things like that, heat emergencies, things like that.
And starting a podcast. No.
Yeah, and starting a podcast. And then I also did orthopedic assessment 1, which was basically evaluation of the foot, ankle, and knee.
Okay.
And I'll tell you, and I'm sure, I've taped a million ankles in my life now at this point. I don't know if I ever taught it,
Right.
So that opportunity this summer, to teach the kids that were just holding the roll of tape for the first time.
Right.
The questions I would get, it would just be like, honestly, I don't know. You just do it that way.
Yeah.
It's just how it goes.
Don't
why
fight the
do we
tape.
put the first strip there? It's like, I don't know. I never thought about it. It's just the way I learned it. And a million ankles later, I'm still doing it.
Same way we're doing it.
It's just, a million different ways to do it. But, and that was really awesome. It was a really cool experience to kind of be part of that. And then to see all those kids go from the summer courses to their clinicals this fall and reconnecting with them as they're like, I actually had to do a SAM splint for a wrist frac, and it's
Right.
good thing somebody taught you that, huh?
And I don't know if people realize in general how tricky it is actually to tape an ankle and tape an ankle well. You know what I mean? Like,
Well, I use that.
no wrinkles, no.
I use that as an example, Doc. But like, I'm sure like you similarly, like if you had to teach somebody the knee surgery, like it just becomes so routine to you that like when you have to like go back and go from like the first step, you know, like it's.
I know very well.
Like like it's just common to you now, and that's how ankle taping was. And and then I'll tell you what, I think all 40 kids I had this summer will tell you I'm the easiest grader ever, because I would just be like, that was, you know, teaching kids for the first time the pivot shift test for the knee. Like I don't even know if I can correct. Like that is one of the hardest tests I think I've ever learned. So like a kid would pull that for a practical, and I'd be like, looks great, man. That's perfect. You know, like
it's hard on an awake patient.
Right.
Sometimes you can get it once, and then they know what's up.
I mean, it's got to be hard on a person without an ACL tear too. Like, you know, like
impossible. Yeah.
Right. And then meanwhile, I'm the patient most of the time, so like I'm trying to grade, but also like worrying about like them snapping my leg, like, you know, like. But it was awesome. And then like I appreciate you kind of leading into that. So the one thing I didn't see coming was that they had the opportunity to not start a podcast, but take over a dormant podcast. And that was for our Pennsylvania State, like our Athletic Trainers Association.
What's it called?
So it's called The PATS Podcast, the Pennsylvania Athletic Training Society. Two guys had started it. They did a great job. They got about 30 episodes in. They both decided it was time to go their separate ways.
Yeah.
One guy actually moved to Ohio, so that kind of, you know, took him out of the mix.
Takes him out of the equation a little bit.
So, you know, it was not really the opportunity, but like hey, we have a void to fill, and we thought you'd be the right person to do it. And so, you know, I had some hard feelings taken on, because I still miss Sports Med on Tap, and that was my first love. But I'm real excited for the opportunity. It's a different type of podcast. I can tell you the one ththing, we never talked about this, you know, years ago when we were deciding, but the name of your podcast has a lot to do with how successful it's going to be. So for all of you that may go and search, you're going to search the Pats Podcast, and you're going to find out how many podcasts the New England Patriots fan base has.
Oh, yeah.
So it's flooded with the Pats Podcast, and it's just like the New England logo, right?
Sure, that makes sense.
You gotta sift through it. You can find the Pennsylvania Athletic Training Society logo, and what I say was an opportunity to showcase the efforts of the athletic trainers in Pennsylvania, continuing to advocate for our profession there.
Yeah.
You know, I had an opportunity to have like a lot of our Hall of Famers on, people that have really meant a lot to the profession, and you know, miss this atmosphere as opposed to. Right now, you know, all our guests are spread across the state, so it's not often we're in the same room. The call in.
And we do that when we need to do it, but you're right. It is just so much better. It's so much more fun.
Personal connection's way better when you have this person in your face.
Do you remember naming our podcast? Not to cut you off.
I do. I remember sitting at home. My wife had some influence on it, and I mean, I actually probably still have the notebook somewhere of just ideas, you know, and.
We were gonna go with on ice, right? Like ice. Over ice. Yeah.
I thought it'd be cool to like, you know, I envision you and me in the break room of Recon, and then you know, basically thinking like, oh, like Doc and I will just make some cocktails, and you know, we'll have a shaker bottle going, Sports Med over ice, you know, and then when the opportunity here at Neck of the Woods came, I said, well, that doesn't really make sense, because you know, everything's, and then.
Everything's on tap.
I remember
here.
You said it. Like the only thing I can think of, like I've gone through a bunch, like on tap, and I was like, "We're done. Like you got it. Like that's it. It couldn't be more perfect."
No, it worked out. But yeah, so I've been having fun with that, especially being like somewhat new. Like I always lived for a while in Pennsylvania, but I was working in Jersey, so I wasn't as connected to the Pat side of things.
Right.
You know, so I'm really just meeting a lot of people that I should have already known. You know, just a lot of influential people that kind of help mold, like, you know, Brandon and I's profession on that side of the river to, you know, what it is today.
Sure.
And we're hitting on a lot of great topics. You know, we have subcommittees within the organization. So one of my most recent guests was the chair of the college and university setting. So, you know, we've been talking about the AT shortages that have been going on, you know, in terms of workforce at the college setting and how that's affecting healthcare at that. And then certainly, you know, and I'm sure you're seeing it too, Brandon, like the going away of the grad assistant model completely changed the landscape of how, you know, we were providing care for a long time.
Can you elaborate on that a little bit? Because I got to tell you, even as a doc and you know, working with you guys, I'm not sure what exactly you mean by that. I would imagine the average listener is not sure.
Brandon, I mean, this was still your era too. So when I came undergrad, we did a 4-year undergraduate degree. We would take our test right before graduation, cross your fingers, you get certified. And then all around the country, there were thousands of positions where they called them grad assistantships. So you would pursue a master's in any field. You would work for the athletic training department, provide coverage, provide care, and you would get a stipend, not a lot, but enough to like pay rent, and then you would get free tuition.
Right.
Yeah.
6-7 years ago,
I think it was
like 2017. I think it's like when they started talking.
Yeah.
So now they made it a for better or worse, whatever your stance is, it's now an entry-level master's program.
Right.
So our students are not certified till after receiving their master's program, which means there are no longer graduate students. And what really distorted the healthcare field is that all these colleges and universities, and I can think of a common friend of ours, not just the college and university saying, but we'll stick with that first, was we all hired GAs because it was a cheap route.
It's cheaper,
You get the softball team, you get the baseball team.
Right.
And they were used to, I could specifically say at Westchester, it's not everywhere it happens, but some of these teams had an athletic trainer traveling to every game.
Yeah.
And that's not really common throughout the landscape. And now as we are realizing, we're down to our last 4 graduate assistants this year. We will not have them ever again.
Yeah.
We're unfortunately back to the drawing board. Is like, well, we can't send somebody to this sports away game because we have 3 home games that day, different sports.
Yeah.
Right.
We're no longer saying like you have this sport, you have that sport. And what we're learning is that the graduate assistants may not have been the best way to go about it 20 years ago. It really distorted the healthcare market for us, Doc.
Yeah. Interesting.
And now that that's going away, we're all left to kind of clean up the pieces of how are we going to make this work.
And unfortunately, that comes with a price tag now too, right?
Yeah.
Like you're saying, like it was cheap work.
Yeah.
Now, granted, you got a
More affordable labor.
Yeah,
More
you got
affordable
a decent stipend or whatever. I mean, that was like kind of the allure. Ooh, that place got a really good stipend. I'm gonna try to get my master's from that school.
I mean, full transparency, my stipend was $4,000.
Yeah, mine was $10,000. Yeah,
Crushing it.
Yeah.
mine was $10,000.
Right.
So yeah, like
Inflation. Yeah.
but the idea behind it is that you're getting a year. Like I did a 1-year master's program. I think you did 2, right?
Yeah.
So you get like those years of tuition for free, and I mean, whatever the case. So say that's $20,000-$30,000. So on paper, that's like a $40,000 job, give or take. When you're coming fresh out of school with a bachelor's degree.
Sure.
And like when I was in school, the idea was like if you want to work at a college, you should get your master's degree. Go get a GA. And go get your master's. If you want to work at a high school level, you should be okay with just your bachelor's, and you can go find your high school and do whatever you want.
Right.
But like Jason said, is now that it's entry-level master's, everyone's coming out of school with master's degrees now.
Everybody. Yeah.
And that's
Across the board.
And it's just unfortunate because they're not certified to provide. Like it's basically like after 5 years will be the first time they cover something by themselves,
right?
And that time has to come, right? Like there's
you got
you have to do your first surgery at some point by yourself, right?
You gotta leave the nest at some point.
Yeah, but now it's like
gotta go.
I always thought that graduate assistance was a great way to be. We trust you to cover, but like we get it that you're still young. Like there's going to be things that you haven't seen yet because you're only 1 year removed from the undergrad.
Right.
And that's a limited amount of hours for 2 years.
People that have been doing this 20, 30 years, and it was a way to kind of bridge that gap.
Yeah.
So that was an interesting episode for anybody that's maybe listening that works at the college setting. I mean, the chair of that committee, had a lot of good insight of how we're going to start restructuring comprehensive care all around. And I think the biggest thing, and it's always tough to say, is like it's not the norm for the coaches and the athletes.
Right.
They're used to always having somebody, right? And now it's like you have to go to this school.
Right.
We trust them. We know that they're not trying to give their team any advantage, but they're your care when you're there. You know? And that's a tough pill to swallow.
That is
for
a tough
coaches,
pill to swallow sometimes. I totally understand why.
Yeah, and now like catastrophic sports, right, Brent? Like at Westchester University, we have gymnastics, rugby, and football. So no matter what, with those 3 sports, we will always have somebody at every practice, every game, either home or away.
Yeah.
It was just that we were really lucky we would send somebody to I don't mean to diminish by any means, but like we had the availability to send somebody to the spring break trip for baseball. Like, that's your team. Like you should be there.
Right.
Right.
But now it's like, well, we got to look at when does baseball go away? Because we might have home events that we don't have enough people to cover if we have somebody on the road, you know. And
on the doctor side of things, I feel like that sort of reciprocating relationship has been established for a long time. You're there. Each team has had their trainers, right? Like individual trainers. But if something happens, then if the doc needs it, like if the away team needs to have a doc look at something, typically it's the doc from the other team comes over and takes a look.
Exactly.
But it sounds like you guys are now being forced into that same situation too.
If you can find us, the Pats podcast, you know, it's I feel like it's going to go off, and I have some ideas coming at the calendar year. One thing I wanted to mention then while we're on the topic too, huge shout out to Kyle Miller, Timber Reel Productions.
Heck yeah, man.
You want to talk about not realizing what you lost till you don't have it. So this venture I'm doing all the editing myself. So I'm uploading, and I could tell you, like, I don't know how many I've put out myself. I haven't mastered it yet, right? Not one episode sounds the same. I feel this early, after it being dormant for about like a year, like at this point, like I'm just trying to build momentum, and I don't think people care about like the quality versus like I got to get stuff out there.
Correct.
Right.
How Kyle was able to turn around the episodes as quickly as he does. And I remember listening back, like, I mean, they were just flawless, right? Like everything, like his intro music would all come in at the same time. And like, now I'm just like, I mean, I don't know. I feel like I started a second too late, but quite frankly, I don't even know how to fix it. Like,
close enough.
We're just, close enough. Man, like, hey, Kyle, I mean, tremendous job. I recommend them wholeheartedly to anybody. I told the Pats president, my number one goal is to raise enough sponsorship to hire Timber Reel Productions for my editing, because A, I want to be done with it, and B, I just know it'll be better than what I'm doing. But yeah, I mean, he's amazing.
Yeah.
So,
and he still does it for us, and he's the relationship has evolved a little bit as the podcast has evolved a little bit. But, we are.
He's
fortunate.
great. He's great at what he does, man. He really is.
You're not lying about that.
Adds a level of professionalism to an otherwise, like a couple of schleps trying to figure it out.
Oh yeah, if I had to do it.
Well, I mean, and it's just like, I remember like we would sit and take notes, and I would be writing like, hey, at the 30-minute mark, Dr. Frey dropped his glass like an idiot, right? And
again,
I would listen to that edit, and like Kyle would edit that out like it had never happened.
Yeah.
And now,
like
when that,
even know. It's
like when something happens, like when I'm recording, like I remember doing an episode from my office, and like my desk phone rang. I literally couldn't figure out how to mute that part out. Like it just ended up being in the episode.
It'll be in there.
Right? You know, it's just in there.
It's a podcast.
Like,
it's there.
Because it was like, it's a crazy world, but he does a great job.
Awesome.
So.
Super glad that things are going well over there. And there've been some texts and whatnot flying back and forth here and there. Probably not as frequently as they should, but certainly here and there. And it's nice to hear like you've taken what you've learned, and you brought it over there, and you're kind of building on it and doing some stuff.
I got to say too. So I still reference, and it's always weird with the students, because some of the episodes I'll reference will be like, so like I used to have this podcast, right? But what you need to do is like go on, and I would like send them the link, because it's amazing how many times the episode, when I look back, when I'd be like, you guys need to go listen to this, right? We had in October of 2022, so not this past season, the season before, I had an elbow dislocation. And I remember our episode with Dr. Dwyer. I was like, you guys need to go on there and listen. Like now that I'm looking back on it, everything, like it's gonna help us in the now, and also like his rehab. You're gonna hear that like the doctor's gonna say like, this is not as long as you may think it's going to be.
Right.
When we had the gentleman, like I remember the scapular fracture, right? That was Sam Darnold. There was at one point that scap I had showed you the picture of, like we had thought like,
is that a
let's
fracture?
first like let's just rule out a fracture.
Of course.
So yeah, I mean, I still end up sending the links, and
turns out it was a Morel Lavallée lesion. We got to talk about that one at some point.
But yeah, I mean, I still get the spread the word best I can.
Well, I mean, that's the beauty of this podcast, right? It's like I use it all the time when I talk to my students. I like when we have a guest on, or like someone like something crazy, like, hey, what do you have? Do you have any questions if you want to talk to a spine surgeon, or like, we've had a couple MLS ATs on. I was like, if you had the opportunity to talk to a major league athletic trainer from the Major League Soccer, what would you ask them? And I would write down some questions, and it's just like, all right, I'll throw those questions out there for you.
Right.
And then I try to get my students involved in the same thing. It's just when we get something that's really interesting, it's like, you guys want to learn something, go listen to this. We got a lot of stuff that we cover.
we had an athlete recently miss his or her senior season, right, because of a torn ACL, and he or she has been itching to do more athletic related things, right?
I think if you're talking about your own athletes, yes, be very, very vague.
Yeah.
So what I remember saying is like, look, I can remember a specific episode from this podcast, right? Dr. Bernardini, where he was adamant that like 12 months is really where things start to take shape.
That's right.
You know, and
Right.
this person is going on 7 months and is just annoyed that we won't let them do more.
Yeah.
Right. Not play yet, but like, why can't I go down there and do this? And
Right.
it's
Yeah.
like, you don't realize like how vulnerable
Right.
it still is, you know,
Right.
and the reasoning behind it was like, well, I want to feel more like an athlete. And it's just like, well, that risk is
You will.
I get it.
Yeah.
but
like the risk,
I mean,
the reward does not outweigh the risk right now.
And I mean, we had someone very similar who was, ACL, came back, did fine in their season.
Yeah.
Next thing you know, they tear the other one.
Right.
And it's like,
So then
We
I got
spent-
something for you. Why don't you listen to
yeah.
this?
Like we
We
spent
covered
all
it.
off season to do all this stuff, and like, yeah, we do your Cybex and your ISO, all the testing, and you're like 85% closed, all this stuff. Okay, yeah, you look good,
Yeah.
but like, what do you like?
Right.
It's tough. Like, what are you gonna do?
A friend of mine, actually, this past week, I was out of her for a little while, for a few years. I have a group of friends, and we would do. It used to be a Sunday night basketball game, then turned into a Sunday morning basketball game. Some pickup basketball, whoever's available and whatnot. And I missed it this past week. And one of my friends tore his Achilles, and he's a radiologist. He knew it as soon as it happened. So then I get a call and I get a text of what should I do? What's the best approach? And next thing you know, I'm forwarding him a couple of podcast episodes. Like, I want you to listen to these. This is my advice. This is how I would approach it.
I think the big one I can think about off the top of my head too is like everyone's seeing Aaron Rodgers walking around, and I was
Yeah.
like, well, there's this episode with Dr. Brandt where we talk about the PARS procedure.
That's right.
And was that Daryl Henderson? Or
Yeah.
no, Cam Akers.
Cam
Cam
Akers,
Akers,
yeah.
Cam Akers, right?
And
And,
he tore the other one just a couple weeks ago.
Oh,
which is
no.
crazy.
No
Yeah.
way.
Yeah.
I didn't know that.
Yeah,
Wow.
he tore his, the other side, I think 3 weeks ago.
I didn't
Yeah.
somehow that escaped me.
Yeah.
But
Holy cow.
I always think like, I don't know, I always remember like everybody talking about the mop ends, right?
Right,
Like there's
right.
always the mop ends. So I
Yeah.
was like, yeah, there's new procure,
Yeah.
I'm not surprised.
Yeah, that's exactly what
You
I
know?
floated out to
Yeah.
my buddy.
Yeah.
Like, there's more than one way to skin a cat, and
Right.
there's there are benefits and risks to each different way. From my opinion, and I kind of went down that road.
Sure.
Like this, if it were me and if it were my Achilles, this is what I would do.
Yeah.
And
Yeah.
exactly.
You know, it's funny you bring that up. Today, I think I saw it on Instagram, on Kevin Hart's Instagram. He posted a video of someone at an NBA game. I want to guess it's those Lakers. It was a guy doing one of those fan half-court shots.
Yeah.
The guy does the half-court shot, takes a couple extra steps, tears his Achilles on the rundown, if
Yeah.
you will.
Did he make it?
No, he didn't make it. And
even
the
worse.
announcer was like, "Oh, you're so close. Let's try again from the three-point line." And the guy's just holding his leg.
Yes.
And I'm like, I don't think he's getting up. Like, the poor, middle-aged guy.
Yeah.
And Kevin Hart, used it as like a comedy skit or whatever.
Sure.
But it was just like, oh, this poor guy. He just went up there, shot the three, and then he took a couple steps, and then you see him just grabbing and it's kind of hobbling around. I'm like, oh, that's not good. It's not good at all.
I can vividly remember too the look on Aaron Rodgers' face too, like that.
Right. Yeah.
I mean, I don't know what your guys' thoughts were, but it just looked like he in shock.
Yeah.
You know, like he knew what had like 3 plays into the season, and it was just like
Unbelievable.
That's it.
he knew, like it was almost like
Snap.
he knew. You know, like
It's typically that and that like who kicked me?
Yeah.
The surprise and then the realization like, oh, there's nobody behind
there's
me.
nobody even around me. Yeah.
I think, what you said, that who kicked me thing, I think that was way back when our first year together, you and I.
I know who you're talking about. Yeah.
When I remember when we were with the Soul and we went out there and he goes,
He stepped on me. I
that
remember you.
MFer stepped
Yeah.
on me, man. He stepped on. And
Yeah.
we're like, there was no one
Yeah.
near you, man.
And I remember even, I don't know if you were with me, but driving to the MRI the next day, and he was still like, I've been watching film, and like, I was like, all right, he was closer to you than I thought, but
Right.
like, I don't think he stepped on you.
Yeah.
Like, and
That's just what you felt.
that's just what you
That
felt.
just-
yeah.
that gunshot to the heel, man.
Right.
That's not the good sign that you
Yeah.
want to see.
It's crazy.
Yeah.
And so speaking of injuries, it's awesome to have you back, and we kind of break from the MO to talk about some
Yeah.
different stuff.
Yeah.
Let's talk about a little bit of injuries.
Yeah. We'll go right off the top. I made a little list of just some recent injuries. The big ones, we're now, it's ironic, right? How Jason and I have this weird life relationship where we kind of cross paths and we kind of do this similar thing
Right.
where we both were at Recon, then we actually both went back to our alma maters and both, or I'm soon to be the primary AT for football, and just like you are.
Congrats.
And so
That's
we're
awesome,
getting
man.
there. Yeah. So like this year was a little bit of a transition year for us. Typically the head athletic trainer at Rowan has been dealing with football for almost her whole career, like sole-handedly, and now it's kind of getting passed off to me for next year, pretty much, primarily. But I think the craziest injury on this whole list that I wrote was from college football, from Florida State. The quarterback Jordan Travis had a pretty wicked tib-fib fracture.
It could go on our gruesome episode.
Yeah, that was a tough one to watch.
I'm sure a tough one for any Seminole fan too.
Did you watch it or no?
Yeah.
Oh God.
And I mean, just the
floppiness.
wet noodle kind of look is just not a good look, and then it was not reported soon thereafter that his college career was over.
Yeah, he made a post or something. Yeah.
And then it's like, oh man, it's never a good sign when they bring out the air casts and all that stuff, and
So rather than go through like all the because we're gonna talk about a couple different injuries.
Yeah.
Have you experienced that? Have you been on the field for anybody having that particular injury happen to either one of you guys?
I have, yeah. I've seen two. I actually saw one fairly recently. Yeah.
I have not. And I'm just making sure, but I feel like I would remember that.
Yeah.
So are you trying to reduce it right there in the field? Are you trying to get it lined up?
No. So we put it in an air cast.
Air cast it.
Air cast it. We we check pulse down there, the two locations, just make sure. Luckily, I mean, I've never seen haven't seen, but lucky enough to have not seen, I guess is the better way to put it, an open one.
Right.
Yeah.
And that was my next question.
So this was,
I
remember getting
Explain what that distinction is.
Yeah,
Open versus not open.
Right. Does the bone come through the skin?
Yeah.
So I remember getting out to the field more recently than I want to admit, but like it was recent, and I just looked and it was like, I got to check. Like I was fully expecting to be seeing the bone, and when I didn't, I was like, man, oh man.
Thank God.
But yeah, we, air casted, checked pulse, sent off in an ER.
Right.
We were lucky enough to be playing somewhere there at nearest level 4. What's the highest one, Doc? Level 4 trauma? Level 3? Level 3 trauma center?
It goes the other way, level 1.
Level 1. I'm sorry. Level 1 trauma center was 10 minutes down the road. So
right.
Beautiful.
He was in a good set of hands, much better than I can provide on the field within, I think it was like 13 minutes from time of injury to arrival at the ER.
That's amazing.
That's really good.
So other one was actually an open tryout, which was really tough. This was many, many years ago. Young man had driven up from North Carolina for a sole open tryout.
Taking a crack, man. He wants on.
I remember him going over the pop-up bags, just doing like some like footwork drills.
Yeah.
Next thing I know, I'm just looking at his foot. He's on the ground. I can't really see his body because of the pop-up bag, but his ankle's sticking up there in the air. I remember he came over, and he was honestly calmer than you would expect, but said to me, like, I don't have health insurance. Do we have to call the ER?
Holy
or
crap,
an ambulance?
man.
And I was like, we absolutely do.
Yeah.
Because there is not much I'm going to be able to do for you right now.
No way you're getting to proper care without it. Like,
so that
sorry
was
about your situation.
Yeah, real unfortunate. I remember thinking, I'll talk to somebody about getting you your tryout fee back to you. But that was one of the worst ones I've ever seen.
Unreal.
Yeah, that's real wild.
Yeah. And you've had the good fortune of not.
Luckily, I mean, I've had some weird stuff, but no tip fib. I had a knee dislocation way back when.
That's a bad injury, man.
And that's unfortunately the opposite of what you were discussing, of how it took 13 minutes to get to the hospital. In this situation, it took like 25 minutes for EMS to get there.
Right.
And unfortunately, there was some neurological stuff happened, some nerve injury, drop foot and stuff like that.
Amputation or
no amputation, thank God. But it was just one of those situations. Holy cow! Like, this is just crazy.
Yeah, no, and that happens. That is not unusual to wind up with the drop foot after that. The LCL tear, ACL. And sadly, even if the nerve is intact, it gets stretched enough that
I mean, the nerve symptoms are almost immediate. Like it was, this is not going to end well.
For the people that are watching on YouTube, I don't know if they all saw us all.
Yeah, we're
all
all
three of
looking
us
behind
taking
us.
a look back. Jess Harrison rolling through.
Former guest, right?
Former guest.
A couple times, right?
Yeah, for sure.
We're going to have her back on pretty soon, I'm pretty sure.
I walked through the energy lab on my way in. They were
Oh,
all
yeah.
seeing patients, and I was like, I'm just trying to say hello, but they were all busy.
Classic. So we kind of touch on a little bit of an open fracture, right? About
Right,
the tib
we were-
fib.
Oh, this was a gross
This
one.
was a good one this week. The Jets safety Tony Adams had what appeared to be a metacarpal open fracture. It looked like a little bit of extra white coming through that green and white glove, and it was pretty interesting. I think Dr. Frey caught this one first. It's funny how I think if you look at Dr. Frey and I's text message volume or traffic, it's very high on Sundays,
Right.
and it's like at all random times of the day. It was in the 1 o'clock to 4 o'clock and then 8 o'clock game.
Right.
And he goes, I think I just saw an open fracture on the Jets game, and I'm like, what? What's going on? Like, and then I found it and I saw a little picture and it looked like I don't
Poking
know.
right through the glove.
I'm gonna guess like 5th or 4th metacarpal coming right through the glove. He took a weird fall, fell on his hand and got up, and then it's oh man.
Might have even been in like an open joint, like MT, metacarpal phalangeal.
Yeah.
And so like it was either a joint or it was a fracture that just tore right on through the glove and sticking straight out.
Yeah.
Yeah.
That was like the second one of the season for NFL that we know of. I mean, Justin Herbert apparently had one as well.
I didn't.
We talked about it briefly.
That's right.
Just we did, in text messages, but we couldn't get Dr.
Dr.
Jennings on it.
yeah,
I don't
we
think
were
it
working on
worked out.
Timing wise.
But yeah, I think Herbert was his third metacarpal, and he had an open fracture, and it was luckily in his non-throwing hand, so he just has this big old splint that he wears now, and he's still out there playing pretty good ball.
What do they do with that hand, Doc? So after they reduce it on the site, or then
No. So oftentimes, what they're going to do is just to cover up some saline, gauze, just cover it
prevent
up.
infection.
Yeah, and just get and get it right to the ER.
Yeah.
Then in the ER, they'll typically wash it out, and the treatment has actually evolved over time. When I was a resident, I don't know, 15 years ago, whatever, in that general vicinity, 15, 18 years ago, and at that point in time, it was like, take it to the operating room that night, wash it out. This 6 hours, golden, golden, like all these different. A lot of that stuff is actually relaxed. A lot of the data is they start the antibiotics immediately. You have a little more time to actually take it and wash it out and clean it out.
So when you're talking open versus closed dislocation, so let's just say even the 5th metacarpal, right?
So dislocation different than a fracture, right?
Oh yeah. So then why can't we reduce it on site if it's open?
So
is it purely because of infection?
Yeah, so it's dragging like dirt and dragging stuff in as you reduce it, and then harder to get it out afterwards. So typically,
That makes sense.
yeah, just kind of clean sterile gauze or clean gauze and whatnot, and moist, and just cover it up and get it to the operating room or get it to the ER. Sorry.
You piqued my interest now because you corrected me by saying dislocation versus fracture. How often is it that you can have an open fracture that's not dislocated?
Right. So when I say dislocation
You know what I
versus
mean? Like
fracture,
when I see the bone come out, I'm thinking, well, it's fractured and dislocated, right? It's got to be the same thing, right?
so the distinction that I was getting at right there was actually fracture being the bone broke, and a spike of the bone came popping through the skin, versus dislocation being that there was a tear or an injury at the joint, so between two bones.
I got you.
But not actually the bone breaking.
Right.
And it was so bad and so displaced, the very dull end of the joint actually popped out of the skin. So you're looking at cartilage, like you're looking at the end of the joint.
Yeah.
So that's not actually, the bone never broke. It was just an open dislocation.
Oh, wow.
Yeah.
Interesting.
And you see that sometimes with like some ankle fractures or fracture dislocations where like it really really roll it, and next thing you know, it's an open joint. There's communication between the outside environment, the outside world, and the actual joint itself, as opposed, which is, to be honest with you, that's probably even worse than a open fracture, because like you should not have the outside world communicating with your joint. That's bad news.
One hell of a way to put it there, for
right,
sure.
Right.
So what's that guy's timeline?
I don't know if it was an open fracture or if it was a open dislocation. My gut, it would be much more common for that to be an open fracture. But the way it happened, the way he kind of rolled his hand
he
up,
rolled his hand in a weird way.
Yeah.
Kind of got tucked under him a little bit.
it may have been a dislocation. And if it was a dislocation, again, hand is my sort of weakness here, so which is why we always have some excellent hand docs on to talk about it. But it's probably not as long as you would think.
Yeah.
So even if it's an open dislocation, I'm guessing maybe it's in the vicinity of a month, maybe less.
Right.
And if it's an open fracture, potentially, it depends on how they treated it, right? Like first they're going to wash it out, then they get some fixation on it. It depends if it was his fourth So the ring finger, metacarpal, whatnot. It's sort of bound on both sides, so it's supported, almost self-splinted. So it's probably pretty quick. Now, a week or two, I'm gonna make a guess. If it was his fifth, then maybe it's going to take a little bit longer. It also depends on his position. He's the defensive back, right?
Safety, defensive back, something like that. Yeah.
So again, maybe something similar, maybe slightly longer. If he's a quarterback, it's a whole different story. If he's a wide receiver, it's a whole different story.
Yeah.
But all he's got to do is get his big ugly mitt up in front of the ball. It's a little easier.
In those cases, right? You're more than likely going to get a maybe a pin or something like that. Whatever the case is, going to be surgical. Cast it.
Right.
Put a bunch of padding on it, give him a club, and he can go out there as long as he
Give
can
him a club.
tolerate it. Club it up.
Yeah.
Well,
if the Jets season was going a little differently too, they might have to go that route.
Right. It might be a little bit more aggressive versus.
It's not over yet.
It's not
They've
completely
somehow
over.
hung on and managed moderately well.
Yeah.
Despite the Aaron Rodgers injury.
It's because their defense is really good. It's the problem,
Right.
but their offense is very, very subpar.
One thing they're leading the league in right now is athletes talked about on this podcast.
Yeah.
Not in the award you want.
Not what you want. Like, not a good stat to have for sure.
Yeah.
Right. And actually, a little plug for some for next week here, right? So in terms of return to play, right? There have been, we're light years ahead of where we used to be in terms of customizing casts and splints and whatnot. And we have a special guest coming on next week. We're going to talk a little bit about 3D printing casts and 3D printing splints, and then kind of looking forward to that one. But there's a role here, and that could be a factor depending on the injury and how to just really and act for not even just for the professional athlete, but for all levels, access to these
orthotics. And
orthotics, exactly.
It's a great company you guys got coming out. I mean,
It should
They
be
make some great products.
Yeah. Exciting.
Stay
looking
tuned,
forward to that one.
folks. Stay tuned.
Stay tuned.
Just to go down a couple things, I think the most somewhat controversial or big names, if you will, would be the Mark Andrews ankle injury from what's being called the hip drop tackle, which was controversial because it causes a lot of injury when athletes tackles and they just kind of drop the hip and slide down.
Yeah.
And then Mark Andrews got his ankle rolled up on pretty good and early reported that he was out for the season. Now their coach was like, there's a chance that he might come back late in the season or something like that.
What was the definitive injury? I watched it happen live.
I don't think they really came out with it. At first, my guess, and I was talking to my students about it, and I was like, if they're saying he's completely done for the season and then they're chalking it up, or it's got to be like a fibular fracture, probably like a Mason-New fracture,
right?
Just because of the weird twist and all that stuff. And I was like, well, that could be it. But now they're saying he's coming back. Maybe it's a really, really bad high ankle sprain.
Yeah.
Because he had that, his foot was playing externally rotated.
The first thing I thought was possibly Liz Frank, the dreaded Liz Frank.
Right.
And but you're right. If they said ankle, that does make a lot of sense.
And I looked like I always do. Like I feel like my Twitter searches is so high on Tuesdays. I was looking all over the place to see if I could get some more information about it. And I couldn't really get anything. And just the only thing that comes up is now like there's a chance he comes back this season. Like all this glimmer of hope of same thing with Aaron Rodgers. There's a chance he comes back mid-December. Everyone watch out. Like, I don't know.
I'm going to stray into a little bit of not like science or data-backed territory. We've had this conversation before, and I just feel like he's one of these guys. Just the injury-prone. I don't want to say made of glass, but to something made of glass, right? Like I feel like he's a phenomenal tight end.
Yeah.
Like a force out there when he plays. Unfortunately, it's way too infrequently that he's on the field.
Similar to Dallas Goedert, who we just talked about, what was that, 2 weeks ago with his forearm fracture? He had this very similar shoulder injury or a similar timing of it, like in the season, whereas like that middle week 8 to 10, when he had his shoulder injury last year, it was out for a decent chunk of time. And it's just like, and I mean, the Eagles just played last night on Monday Night Football, and you could tell that they were scratching for a tight end, And even on top of that, I think our backup tight end ended up getting hurt last night. So then it's like, we're down to the third string tight end.
Yeah.
Please, for God's sake, put Julio Jones at tight end position and hope for the best.
Right.
Right.
Who were the Ravens playing? Was it the Browns this past week? I don't know if you guys saw. Whoever it was.
Browns or Bengals.
Yeah.
That was just like a war.
Yeah. But you see Lamar Jackson. Actually, same thing. I remember him going down thinking like, that's definitely a high ankle sprain, maybe a medial ankle sprain. Yeah. And he limped off. I think he missed like a series.
Yeah.
I don't know how he came back. Like how, based on what I saw on like a freeze frame, how it wasn't more significant.
Right.
How he didn't miss weeks on end.
Yeah.
So it's right.
And I was equally pissed, Doc. Sorry to cut you off. Like, I was playing him in fantasy. So I just remember being like, all right, he's out.
Yeah.
He's out. And then, he comes trotting and lights me up for 3 touchdowns after that.
Right.
You know?
It's
but how he
amazing.
bounced back from that, just that mechanism, it was unbelievable.
So I think that goes back to some extent, some people are just more injury resistant and resilient, and some people are more just a little more injury prone.
Yeah.
What has been as athletic trainers, what has been your experience on the field? Like, are the same guys hurt over and over and over again? Whereas some guys, it's just like they're impervious, they're unbreakable kind of a thing.
No, I think it's a happy medium of both, right? Like you see those guys who are the frequent flyers in the training room, right? Like, oh man, this kid's here again. Like he's here for something else.
It's a comfortable place for them.
Yeah, or like we joke around sometimes. We're like, all right, we're gonna treat you now, but you're not allowed to get hurt anymore. Like this is like. We have 18 injury evals on you, man. Like, come on, we got to figure something out here. But then you have guys who are like, you can't stop them, no matter what it is.
Right.
Like, no, just tape it up and I'll be fine. Or I've had people who are real bad ankle sprains and they can play football in between the whistles.
Right.
But every time they go to the huddle, they are limping like they can't walk.
Right.
But you put them down, put them in their stance, and they get out and they're fine.
They're
okay and they can block somebody. I mean, this year we saw it at Rowan. It was an opposing team. Early on in the game, one of their linemen got hurt, and he was blocking on one leg. I'm kidding. He's jumping back on one leg, blocking our guys. And it's like, how's this kid not getting exposed yet?
Right.
He goes out. I assume he gets taped or whatever the case was. He finishes the game.
Yeah.
It's just, I don't know how some people are super resilient and can do it.
Yeah.
And other people just can't catch a break.
I think perception of pain has a lot to do with that too.
Yeah,
I think you're right.
I don't know enough to really comment on it, but I think the frequent flyers that you talk about, it's just well, something's not right, so fix it. And it's
right.
And then other people can just be like, well, yeah, this is also football.
Football hurts.
I haven't felt right since we took preseason physicals to be quite right. You know what I mean?
Yeah.
And I think some people just have a different way to perceive it than others.
That's fair.
Some people feel it more.
I'm not even touching on some guys are tougher than others. It's
That's
just
not where we're
some
going,
people just the pain is perceived differently.
Yeah.
You know?
It's just that specific injury or that specific problem doesn't register high on their pain scale. It's just they just work through it. And I also think it goes, for me personally, again, this is not science-based whatsoever, but it goes beyond that, where just some people are a little more flexible, some people are a little more their perception or their reaction time is a little bit better, just enough so that they can roll with the hit, roll with the blow, just enough. The most minute little difference, but it's enough to turn what may be an injury for this guy into a bruise for that guy. You know what I mean?
Yeah.
And I feel some people just set up to just survive a little longer. Yeah. But even the best, right? Tom Brady had this incredible careyor, but he did tear his ACL at one point. It doesn't matter who you are. Eventually, sometimes you get caught. It's just how it goes.
We always said injuries are physics, right? If your tibia is at this much rotation, there's this amount of force from the lateral side.
Yeah.
No one's ACL is not going to tear. You know.
And that actual fact right there, I think that blew me away when I was a med student learning about orthopedics. And I think ankle fractures are sort of the best description of it, where we have these categories, the way that we name or classify injuries, and it holds true. Yeah. If you have this type of injury, like you plant and you rotate or whatnot, the bone fractures the same way every time. And so you can know how the injury occurred almost every time based on the fracture pattern. Right. And to me, that was you just assume they get hit and it just blows up, right? There's cracks everywhere.
You could look at it
there's actually science to it.
You could look at it from both ways. You could just be looking at the x-ray for the first time and see that pattern and then probably guess how the injury happened. Or we might be able to say, based on the mechanism, it's probably this type of fracture.
Right.
You know what I mean?
Yeah, and it's interesting where we talked about those people who have the pain tolerance or whatever, and then there's people who are really tough and really skilled, and I'm going to segue into another injury here is Cooper Kupp.
Right.
The guy is amazing when he's healthy.
Right.
But man, he can't catch a break this year. The hamstring to start the year. He had a re-aggravation of the hamstring in training camp. Came back, did pretty well, and now he hurt his ankle. Yeah. And he has a history of ankle injuries, which is another topic for another day. So now he's, and of course, I love the reporting. It's a low ankle sprain, which is, not the dreaded high ankle sprain, which takes a lot more time.
It's helpful.
But still, it's still going to have to be something to deal with. You got to, the ankle, and then you worry about the re-injury. And the touch on the re-injury was the biggest, I think the big splash of the year was Devon Achan. He came back from IR this year and played a couple plays, and then he was out again. He apparently re-aggravated.
3 plays.
3 plays.
Also on my fantasy team.
Little personal there.
Well, it's a great pickup.
Yeah.
Great pickup.
Got him late, too. It was like 7th round, something like
Oh,
that.
did you draft him?
Yeah.
You're an all-star, man. That's foresight.
Yeah,
so
that's
he was
good.
like, I mean, he was like just somebody I was just stashing away, and then after weeks of 60+ points, I was like, I'm gonna have to find a way to get this guy in the
winning
lineup.
the league. Yeah.
Yeah, you thought you were going all in.
Yeah.
Next thing you know, he just gets hurt again.
Well, I think the other thing too about Cooper Kupp, it becomes volume, right? Like, being who he is for a team not where they were 2 years ago.
Yeah.
Being
2 years older.
I don't know what the percentage is, but when you look at it and who they have, it's like 7 out of 10 plays are going his way.
right.
It's only a matter of time, right?
He's getting tackled the most out of the whole team, right?
Yeah, I mean, something's just bound to happen when you're just putting yourself at that much, exposure.
Well, they have the rookie, Pakua.
Puka Nakua, yeah.
Puka Nakua. Holy cow.
He's a
Came
fun
out of
one.
nowhere.
Yeah,
Came
he's
out
a
of
fun
nowhere.
one. Yeah.
And I mean, good for him, right? He's seizing the opportunity of Cooper Kupp being out. He's the primary target, and they don't have that many other targets. I mean, they do, but
they're a good team, especially when Stafford's playing, and they're that much better. As long as they have that one guy that can do that. And, right now they have 2, and one of them's hurt frequently.
And they accomplished their goal, right? They went all in a couple of years ago.
They did.
They got their win, and
they got it.
And
now they're trying to stay afloat.
Trying to stay afloat, and But I mean, it's tough for a guy like Cooper Kupp. I mean, just what he does for the league, what he means for the league. The amount of viewers that tune in just to see him, and then just the. And we talked about hamstring strains a lot too, like that re-injury. It's like it's almost just like it's just
once it happens,
it's just never the same.
It's tough,
and especially for a guy that has to rely on speed.
Right.
Yeah.
You could hide it in an O lineman where we just got to get you into your 3-point stance and stand upright, but
just hold on to the big guy in front of you.
Yeah, and at really not many points where you're asking to sprint 60 yards downfield like we are for Cooper Kupp, but. Yeah, I mean, once you do it bad enough, and then you have a guy that just like, all right, well, rehab, and then just, we got to get back to sprinting, and it's just that tissue just never aligns perfectly.
And then same case as the Justin Jefferson case, right?
Yeah.
It just came out today, I think today or yesterday. He made a tweet or a social media post about he goes, my health is the most paramount thing to me.
Sure.
I don't care about your fantasy team.
Yeah.
To all the people out there, stop sending me DMs and stop messaging me about your fantasy. I don't care. Yeah. And that's the thing with hamstring specifically. Is if he goes out there too early, he's going to get hurt again, and he's going to be right back on the IR where he started.
I mean, it had to be pretty bad, man, because he's been out for a while.
Yeah.
But that's the nature of those injuries, right? Like when they're really bad, it's tough to get back. It's tough to feel normal, and as soon as you try, it becomes an issue again.
Yep.
Yeah. I hope it's right around the corner.
Yeah, it seems like it is. I think it is. I think the next couple of weeks he's going to come back, but we'll see. We'll see.
For sure.
But hey, man, this was a good time.
Yeah.
This was a good one.
So you've been part of it in the past. I feel like we should mention it. I just learned of it today. This year's Sourfest. For May 18th, Brian behind the bar always takes care of us, letting us know May 18th. Total Turf. Neck of the woods in the back there.
Sign me up. I'm in.
Always a packed parking lot back there.
Oh, it's a party.
It's a nice day too. I mean, they'll get people outside, have them inside.
Mm-hmm.
Right.
A lot of beers flowing.
So many.
Yeah.
We talked about, I forget what Frank said last week when we had him on, but I was talking about it to somebody else about how many beers he had, and he had 40-some.
Yeah.
I think 40-some different varieties of drinks. I think 30-some were sours and 15 or 20 seltzers or everything. The guy's a magician back there.
That's like magic. Like I don't know how logistically how you pull that off, right? It's like cooking for 500 people, kind of like how do you get it to all work? I
don't know.
Amazing.
Yeah.
Well, Jay.
Anyway.
It was a great
awesome.
time having you back.
So happy able to come back and join us for a little bit.
Fun.
Hopefully it doesn't take a year and a half to get you back on again.
Yeah.
We'll definitely do it. But hey, I mean, if we have to, we'll definitely get this little void of this late November pre-holiday after football season stuff. It could be the Jason Kopec hour.
Jason's not aware of the milk tube.
I know. We have to end the show with the milk tube with Jason.
Yeah.
So this is going to be a good time.
So for those of you who don't know, also at the Neck of the Woods, Frank has 2 taps, one on either end of the whole selection of the taps, and they're special taps. They don't go straight up and down, but are off to the sides. And so essentially, you can probably see them right now. Take a look back there. The way the ball tap is set up, it creates a little more turbulence, and so he'll choose whichever beer is going to have on there. and he actually creates a little more foam within the beer. So you look at it and you're like, this is a
Big
mistake.
old glass of
pour.
foam, but
big old glass
so
of foam.
good.
But it's actually purposefully done in the way that it creates that turbulence. It's actually very
And Brian's drinking one
flavorful.
right now. If you go look over
Does
there,
he really?
Brian is
Brian's got
drinking a
one?
I
milk
can see
tube.
why it's called a milk tube. It
looks like a
just
glass of milk,
glass
yeah.
And it is a lot of fun to just knock down a milk tube together. So, I had completely forgotten that the milk tubes came after you had left.
Yeah.
So I'm looking forward to
Yeah.
finishing up.
Well, thank you guys for having me. This was great. Like I said, love what you guys are doing. Love to see it where it's at.
Yeah.
And happy to be back down here.
Yeah.
Catch up with Brian before the night's over.
Heck
And,
yeah.
see Dr. Jess Harrison here. We're going to say
Yeah.
hi to her.
Yeah,
But
absolutely.
yeah, this was awesome, guys.
Thanks
Thank
for
you.
getting this all going with us,
Absolutely.
man. Good to see
Awesome.
you again, buddy.
Good to see you guys. Appreciate
All
it.
right, so before we go ahead and close out our tab here, we're just going to give a quick shout out to our sponsors, the Energy Lab, the region's premier sports performance center and destination, Neck of the Woods Brewing Company, setting us up with the best beers in the local area, and lastly, Timber Reel Productions, helping us putting this video and audio out to all of our fans. We appreciate you. Everyone have a safe holiday season with Thanksgiving around the corner. We'll be back soon. Thanks again.